So when I speak to people, they always want stretches for their low back. They always want to do knee to chest stretches and things of that sort. And the problem with knee to chest stretching is that you are actually loading the discs in your low back. You are compressing the discs and it leads to more injuries. The problem is the stretches feel good while you're doing them. So people do knee to chest stretches. It feels better when they do them. And then of course, because they've compressed their back, it begins to inflame and later on they start feeling some pain. So then they start stretching again. And you don't want to keep stretching into flexion. This is the last thing in the world that you want to be able to do easily is flex your back forward. When you do that, your compressing discs are going to blow up and you're going to be sorry you did it. So I don't actually like knee to chest stretching exercises. The comfort stretch that I showed you should be all the stretch that you need for your spine, because we're going in it. You're not weight bearing. We're going as far as you can in every direction. That should be all that you need to keep your joints moving properly, okay? There may be certain stretches that I did give you that stretch out your low back, but for the most part, I really rather you didn't do it. Where people get very tight, though, is the hip. They get extremely tight in the hip. So they need to learn how to stretch out their hips. So this is how we're going to do it. The first stretch is going to be a hamstring stretch. Hamstrings are the back of your legs, okay? The trick of the hamstring stretch is to, if you can do this on a table, great. Do it wherever you can. But first of all, you want to square your hips up with your leg. You don't want to be open this way because you want to be stretching all, there's 3 muscles back here. You want to grab all 3. Second of all, you don't want to flex forward this way. If you flex forward this way, you're flexing and you're going to blow out a disc in your back, and we don't want that. So what you're going to do is keep your chest up high and lean your belly button forward. If you lean your belly button forward, you're stretching your hamstring muscles, but you're not putting your low back at risk. If you can grab your foot, fantastic, you don't have to. So it's just chest up, chest forward, go as far as you feel you can, you feel a stretch right back in there. The second stretch that I have people do is an adductor stretch. Now I'm going to hop on the table to do this, but please don't do this on a table. How you do an adductor stretch is spread out one leg this way, and you're going to lean your hips, your body to the right. Now notice how I'm not leaning this way. Why am I not leaning this way? Because we don't want to hurt our low back. So all we're going to do is lean towards our knee, stretching the inside part of our leg. We're not putting our spine at risk. So remember, none of this shoulder tilting crap. Just push your hip bone towards your ankle. You'll be able to stretch it just fine. The third stretch is the hip flexor stretch. I'll do it on the table as well. This could be done on the floor. It's a little tricky though. The trick is the leg that's on the floor has to be as relaxed as possible. If you stretch a muscle that you're clenching to try to stand up, you're going to stretch the tendons and you get tendonitis. That's bad. So you want to have one knee on the floor, one foot up. You want to grab onto something if you can. And what you do is, keeping your chest up high, keeping your spine straight, we're going to take this point of our hip and lean it forward. We have to relax the bottom leg as much as we can, which is why I want you to hold on to something. If we're pushing our knee into the ground and try to stay up, we're going to get tendonitis. We're going to get pain right in our hip. You don't want that. So let your hips sag down. Hold on to something. All the weight should be right leg and 2 hands. You can feel this right in your front pocket. The last stretch is kind of uncommon. I don't really give it out very much, probably because most people can't do it without falling over. But if you want to stretch out the outside part of your hips and your IT band, we're going to stretch the right side. We're going to cross the leg in front, and then we're going to lean our hip to the right. Now I'm not bending too far this way because now I'm stretching my low back and I don't want to do that. All I got to do is bring that hip to the wall. I can still keep a straight spine while I'm stretching out the stuff on the right side of my hip. The more flexible we are at the hips, which are the things that are supposed to move us around anyway, the more flexible we are here, the less we need to flex here. The less we need to flex here, the less likely we are to tear a disc or break something and cause ourselves an injury. Okay, so let's get some flexibility here, not worry about this so much.